Hi, it's Dr. Sabine Wünschmann, obstetrician and gynaecologist. I want to thank my community that so kindly many of you sent in questions. And the questions today, they are regarding the premenstrual syndrome, which is a very neglected subject, and a lot of women suffer from this syndrome. I see it every day almost in my clinical practice, and it is something that socially and in our society is not really taken very seriously. You know, they say, oh, she gets her period or she's hormonal and that's it. And you actually feel in a quite despair and difficult situation, and you feel that you're not being heard. So I would like to share with you the questions that we have received today. This is Jane, she's 35 years old, and after having her twins at the age of 35, she experienced severe PMS symptoms, and she's wondering what is happening to my body. Surely after, delivering twins, even though you did it in a very good age at the age of 35, the hormonal turmoil that you have been going through with the extremely high estrogens during the time of pregnancy, and then with the delivery, the sudden drop of it, that with the removal of the placenta and the birth of the babies, the hormones, they really go down the drain and down into the basement, whereas 9 months you were really high. And that combined with an increasing super high prolactin because you're breastfeeding and you're double pumping, that is the epitome of such an amazing stress level on your body that your stress markers and your cortisol just cannot cope, and that results in putting fat everywhere where you don't want it, being very, very irritable, being extremely emotional in moments where you would otherwise not blink, and it's definitely a difficult phase for you to go through. So I would like to encourage you to just look at the bright side, really enjoy your children, be grateful that you have the twins, and really try to supplement with the right food, with the right amount of little bit of exercises, and if it's just breathing exercises, because probably it's not possible to get in more because you have the twins, and the right supplements, that you will get through this. And at some stage your body will regain its balance and you will recover. It's not going to be forever. So the next question is another lady, a little bit older, 38 years old, who's experiencing depression a few days before her menstrual bleeding, together with severe bloating and migraines. Will these symptoms continue for life? Doctors have suggested the pill, antidepressant, and I don't like either of these solutions. Dr. Sabine, can you help me? Here we are in a position that this lovely lady is experiencing in a very drastic way the changes of her hormonal pattern that happens in the month. We have usually the peak of the estrogen towards the ovulation, and then the estrogen drops a little bit and the progesterone starts going up. If for some reason the progesterone does not increase to the degree that it would be sufficient and wanted, these symptoms are occurring, that you are really feeling so bloated and you have this terrible depression, you cannot get out of bed, and you really feel that the world is collapsing around you. And as soon as your period is starting and the flow starts, everything lifts. It's like a dark cloth that is lifted above your head, and everything is so much better. So in this case, we really need to look at the hormone levels in the second phase, especially towards the period, measure them and supplement them in order for you to get some alleviation. Again, this is a quite severe sign of your hormonal imbalance at this time of the cycle. But I would encourage you to check your levels and seek advice, and you should be helped. The next case is that it's a young woman, 30 years old, and she experiences 2 hours after her 30 minutes of swimming terrible migraines. Are these my hormones? These are your hormones in the greater sense. They are not your gynecological hormones, but these are your adrenal hormones that don't seem to be able to cope with the stress of the 30 minutes of swimming. So maybe if you do experience this at the rhythm of exercising and not feeling invigorated after the exercise, but actually on the contrary experiencing the migraines, that means that this sort of exercise is not the right sort of exercise for you at this time of your life. So you should probably seek something more gentle and something more sort of toning, stretching, and not so much into the aerobic direction, so that your adrenal glands, they don't get exhausted, because that's what it looks like, that you exhaust them with the 30 minutes of swimming, and then the body responds with vasoconstriction and you get the migraines. So if you do experience this kind of pattern, just change your sort of exercise and go into a gentle way, and maybe try and see if there's a pattern when this occurs in certain phases of your cycle. Maybe you should just do the aerobic swimming and the more active, aerobic exercise in the first phase of your cycle. Let's see if there's a pattern, and there's definitely a solution to it. Let's get to our last question. After ovulation, I am very short-tempered with my children. I blow up in a millisecond. And what is happening to me? So again, the miracle of the hormonal interaction between all the hormones that are working with each other, like in the symphony orchestra, that they should really work together and be very symmetric and very harmonious. It seems in your case that you are, after the ovulation, that the peak of your progesterone that should be produced is not happening. And if that happens, then you get short-tempered, you're fused, and you could pick a fight with anybody. If it reaches out to your children, then that is something that I can understand that you would be very unhappy about it, and also would need to supplement and choose the right foods. I mean, this list of questions, we can just go on forever, because there are so many women that they do have these kind of complexity of symptoms, and I would like to encourage you to reach out and stay tuned with my community, because we're constantly putting online solutions and assistance and help, so that you will find your answers. Thank you very much.